Hello there! Hello nurses and hello world! This is nurseniezl and welcome back to my channel. Video is solely for demonstration purposes only, as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden 10th edition. All information presented are public domain materials accessible to the relevant governing organization's website. Subtle similitude may be noticeable, however, this is not intended to be definitive guide to the NMC Part 2 test of competence or the OSCE examination. This can be helpful materials for overseas nurses or internationally educated nurses to learn and adapt to the UK clinical setting and transition effectively into practice. So in today's video, I'm going to show you how to pass your OSCE exam when it comes to implementation station. So this is going to be a good practice if you watch this video. And not just that, also a bonus, we've got a topic for today, which is subdural hematoma. So these are possibly the medications that will be given to a patient who's suffering or who's having subdural hematoma, which all gonna be depending on the situation or from the assessment or the scenario from the assessment. This implementation stations is made up. I'm not saying that this is from the actual exam, but I'm just saying that this scenario is depending on the assessment scenario, the situation, and the condition of the patient. In which, in this case, we are going to give medication to our patient, which is Marina Winters. If you don't know what I'm talking about, you can head on to my nurseniezl playlist, in which you can watch the video regarding subdural hematoma from the assessment, planning, and now we're doing implementation. And also, after this video, you can watch the evaluation video, which is I'm about to post so soon. Alright, are you ready? Let's start! Nurses, please remember, when administering medication, you have to remember the 5 R's, the 5 rights of the patient when it comes to safely administration of medication. Remember, is this the right drug? Is this the right dose? Is this the right route? Or is this the right time? Or is this the right patient? Please remember the 5 rights. Before we head into it, I'm just gonna read the scenario. It says here, Marina Winters has been admitted in your ward following a fall. She has been diagnosed with subdural hematoma. Please administer and complete the documentation of 1200 hours or 12 noon medications in a safe and professional manner. Nurses, always remember to talk to the person. Please verbalize what you are doing and why, especially to the examiner. Read out the chart and explain what you are checking, giving, not giving, and why. Also, you have to complete all the required drug administration checks. Complete the documentation and use the correct codes. The correct codes for non-administration are on the chart. Check and complete the last page of the chart. And remember this, nurses, you only have 15 minutes to complete this session, including all the required documentation. Remember, if it's not documented, it didn't happen. So please complete all sections of the document. Hi! Hello. Let me just gel my hands. And let it dry for 30 seconds, making sure that the scene is safe and provide privacy and dignity for the patient. Hi there, I'm nurseniezl. I'm gonna be your nurse for today.
Hello, nurseniezl.
Yeah, so I am here to give you your due medication, which is according to this prescription at 1200 hours, okay? And it's due now, alright? So, before I do that, are you alright? Are you comfortable?
Yeah, yes I am.
Okay.
Yeah.
Would it be okay if I just check your ID? Yeah?
Yeah.
Okay. Can I please have a look at your wristband? Okay. Okay, comparing it with the prescription, can you please tell me your full name, please?
Marina Winters.
Marina Winters. Okay, and your date of birth?
1st of the 12th, 1967.
1st of the 12th, 1967. And your hospital number here is MW12345678990. MW12345678990. And I can see that you're wearing a red wristband. Are you allergic to any food, medication, or latex?
I'm allergic to penicillin.
Penicillin. I can see that it's the same thing here in my records. And what kind of allergic reaction you get from that?
I get rashes.
Rashes, okay? Don't worry. Gel my hands again. Since I have touched the patient, let it dry for 30 seconds. So, are you in any pain at all?
Yes, I am.
Where is the location of the pain?
I'm having pain at the back of my head and also on my left arm and left hip.
Okay, can you rate the pain from 0 to 10? 0 being no pain and 10 being the worst?
10.
10 to all of it?
Yes.
Okay. Have you had any pain relief at all?
No, I haven't.
Okay, don't worry. Since I already got your prescription right, I will check if you have due analgesia. If not, I will ask the doctor to prescribe you an analgesic, okay?
Okay.
Alright, so I'm just gonna go and prepare everything. So in the meantime, if you need me, here's the call bell, okay?
All right.
Please call, alright?
Okay.
By the way, what do you want me to call you?
You can call me Marina.
Okay, Marina, I'm just gonna prepare everything. If you need me, don't forget you get your call bell right there, okay?
Okay.
Okay. Gel my hands before leaving the patient, and I am gonna dry it for 30 seconds. And I need to wash my hands using the steps of hand washing. First, wet your hands. Obtain some soap. 5 backwards and forward stroke from palm to palm. Right palm over the left dorsum and vice versa. Fingers interlaced. Fingers interlocked. Rotational rubbing of the thumb and vice versa. Rotational rubbing of the palm with finger clasp. Rotational rubbing of the wrist. Now rinse it thoroughly with water. Pat it dry with clean towels and dispose it in the domestic bin. Okay, before preparing the medication, I need to read the prescription. Okay, for you to be able to see the prescription, I'm gonna put it over there. Candidates, you only have 15 minutes for this procedure. So it's today and 1200 hours. So surname Winters, forename Marina, date of birth 1st of the 12th, 1967, hospital number is MW12345678990. The ward is general ward, date of admission is today. The height is 5 meters. The weight is 48 kilograms. Body surface area is 1.70 meters squared. Consultant is Dr. Shanai Ishii. Time of admission is 6 in the morning. So there's a prescriber's name, Dr. Shanai Ishii, with GMC NMC number S123456. Signature, Shanai Ishii is there, blip of 1234. The patient is allergic to penicillin. The effect is rashes. There's a signature, Shanai Ishii, blip number 1234. The date is today. Going to the next page. Again, this prescription is for Marina Winters. The information of the patient is correct and complete and the same as the first page. Okay, I got here the codes and once and only medication or pre-medication. It's right here. The date is today. The drug is paracetamol, 1 gram orally, stat dose at 12. There's a prescriber signature, the print name, and the blip number, Shanai Ishii, Dr. Shanai Ishii, 1234. So, as you can see, this is already due. However, I am not gonna give this, Miss Examiner, because the patient weight is less than 50 kilograms. So what I'm going to do is to ask the doctor to re-prescribe this and make sure that it's according to the weight of the patient. Going now to the next page. Again, this prescription is for Marina Winters. The information of the patient is correct and complete and the same as the first page. So prescribed oxygen. Miss Examiner, what's the current oxygen saturation of the patient?
98%.
98%. So the target oxygen saturation of the patient is 94 to 98%. So I'm not going to do anything here since the patient is within range. Going now to the next page. Again, this prescription is for Marina Winters. The information of the patient is correct and complete, and the same as the first one. Let's come now to antimicrobials. First drug here is amoxicillin. The date is today. The dose is 500 milligrams. Frequency is KDS orally for 7 days. The start date is today. Finish date is 7 days. Prescriber signature and blip number Shanai Ishii, and blip number is 1234. Printed name Dr. Shanai Ishii is in there. So the time is 12. This is again due. However, I'm not gonna give this since the patient is allergic to penicillin. So I'm gonna code this later on during the documentation. The next drug here is anticoagulation therapy. We've got edoxaban for today, 60 milligram orally, once a day, orally for 7 days. The start date is tomorrow, finish date is 7 days. There's no prescriber signature and blip number, and there's also no print name. So I'm gonna ask the doctor to check this prescription and re-prescribe it if need be, okay? Going now to the next page. This prescription is again for Marina Winters. The information of the patient is correct and complete. For the regular medication, I got here ondansetron for today, 8 milligrams orally, twice a day orally. The start date is today. There's a prescriber signature, Shanai Ishii, and the blip number 1234. Printed name of the doctor is there. The time is 8 and 18, so this is not my time. I'm gonna proceed now to the next medication. I get here amlodipine. Today, 10 milligrams orally, once a day. The start date is today. The prescriber signature, Shanai Ishii. Blip number is 1234. Printed name, Dr. Shanai Ishii is in there. And it was already given at 8, so it's already been given. Next prescription here, we've got the drug name, furosemide for today, 20 milligrams orally, once a day. The start date is today, and the prescriber signature, Shanai Ishii, is there with a blip number of 1234. Printed name, Dr. Shanai Ishii, and the time is 12. So I'm gonna prepare this medication. Miss Examiner, is this tray clean and disposable?
Yes, it is.
Okay, so I'm gonna use this one. Make sure to prepare the medications in separate pots. Okay, I get here furosemide, 20 milligram tablet. Expiration is 4th of the 5th, 2029. Before I prepare this, Miss Examiner, can you please tell me the blood pressure of the patient?
It's 130/80.
Okay, 130/80. So I'm gonna prepare this one. Moving on to the next page, again, this is for Marina Winters. The information of the patient is correct and complete, and the same as the first one. Again, another regular medication, bisoprolol. For today, 5 milligrams once a day orally. The start date is today. There's a prescriber signature and a blip number, Shanai Ishii, 1234. The printed name is there, Dr. Shanai Ishii, and the time is 12. Since the blood pressure of the patient is 130/80, I can prepare this medication. So I got here bisoprolol. So I have got here bisoprolol, 2.5 milligrams. Expiration date is 18th of the 10th, 2028. Comparing with the prescription, it says there bisoprolol 5 milligrams. So I'm gonna get 2 tablets. There's no more prescribed medication afterwards. Going now to the next page. As required medication, again, this prescription is for Marina Winters. The information of the patient is correct and complete and the same as the first page. So I got the first drug here, codeine phosphate. I've got today 30 milligrams, 46 hourly, orally. The start date is today. The prescriber signature and blip number, Shanai Ishii 1234. Print name is Dr. Shanai Ishii is there. So as you can see, it's a PRN medication, so there's no time written there. If you're gonna give this one, if you're gonna administer this, then you're gonna be the one who's gonna put the time in there. Just so you know. Since the patient is complaining of 10 out of 10 pain and paracetamol is wrongly prescribed at the moment, I can give this to my patient. So I got here codeine phosphate 30 milligrams. Expiration date is 7 of the 12, 2029. So I'm gonna get 1 tablet. Going back to the prescription, there's no more medication in here. Going to the next page. Again, this prescription is for Marina Winters. The information of the patient is correct and complete and the same as the first page. When it comes to infusion, there's no prescribed medication in there. And that's it. Just gonna gel my hands and I'm gonna go now to my patient. Let it die for 30 seconds. I'm going now to my patient. Hi again.
Hello.
So I'm back. I got here all your medication. Let me just gel my hands. Let it dry for 30 seconds. So before I give this medication, can I please again recheck your ID?
Okay.
Can you please tell me your full name, please?
Marina Winters.
And your date of birth?
1st of the 12th, 1967.
And your hospital number is MW12345678890. 123, okay? And you we've established that you are allergic to a medication.
Yeah.
Which is
penicillin.
I can confirm it. It's the same with my documentation. And what kind of allergic reaction you get from that?
I got rashes.
Rashes. Again, it's the same with my documentation. Before I give this one, are you comfortable?
Yes,
Do you have any pain at all?
Yes, I'm still having headache and then pain on my left arm and left hip.
Can you give me the pain score, please, from 0 to 10? 0 being no pain and 10 being the worst.
10.
10. Okay, don't worry. I got your pain relief right here, okay? I'm gonna gel my hands again. Let it dry for 30 seconds. So I got here all the medications that you needed. So you are prescribed with paracetamol 1 gram. Unfortunately, I have checked that your weight is 48 kilograms. So I need to again just ask the doctor and reconfirm this one, and maybe the doctor will re-prescribe it again. All right.
Okay.
So let me move on to the next page. You're also prescribed with amoxicillin. However, you're allergic with that. So I'm gonna ask the doctor to re-prescribe another antibiotic that is not penicillin derivative, okay? I got here your first medication, which is furosemide. So this is your diuretics or your water pill. You are prescribed with 20 milligrams, okay? But the side effect of this one is you will keep on weeing, yeah? And your blood pressure might go a little bit lower, okay? Because you're gonna be excreting water, okay? But don't worry, we will monitor your output, okay? Here you go. You have water with you right here?
Yeah.
Okay, are you happy to take it?
Yeah.
Okay, did you swallow it?
Yeah.
Okay, thank you very much. So I got here the next medication, which is bisoprolol. Bisoprolol is for your hypertension, okay? This is an antihypertensive tablet. You are prescribed with 5 milligrams. So, side effect, you might have hypotension, which your blood pressure might go down, okay? But don't worry, I am here. We will monitor that one, okay?
Okay.
So you're prescribed with 5 milligrams. That's why you have two here, 2.5 tablets. Have you swallowed it?
Yes.
Okay, thank you very much. So moving on to the next medication. I'm not going to give you paracetamol. You got here another pain relief, which is codeine phosphate, okay? This is another pain relief. 1 tablet of 30 milligrams. Side effect of that one is you might have constipation, okay? So I advise that you still take adequate fluids, okay? Okay, have you swallowed them all?
Yes.
Thank you very much. I just need to make sure to check your observation every now and then because you got antihypertensive tablet and furosemide at the same time. And since you're taking codeine, which will cause constipation, you need to inform us regarding your bowel output as well, okay?
Okay.
So moving on to the next page, nothing here anymore. Thank you very much. Those are all the medication that you are due for today. The other medication, I need to speak to the doctor and get back to you for that one, okay? Thank you very much for today.
Thank you.
Again, if you need me, here's the call bell. Don't hesitate to call, all right? Are you comfortable at the moment? moment?
Yes,
Okay, so I'm gonna document for a bit. If you need me, again, here's the call bell, okay? Let me just document for a bit, alright? Let me just gel my hands. Let it dry for 30 seconds. I'm just gonna document. Marina, I'm now finished with the documentation. So, how are you? Are you alright?
Yes, I am.
Okay, again, I'm gonna get back here to check for your observations and your pain as well. I need to reassess that one. But in the meantime, I'm gonna go now. Here's the call bell if you need me, okay?
Okay.
Alright, so for this one, I'm gonna dispose this in the clinical waste bin. And then I'm gonna wash my hands using the steps of hand washing after the procedure. And that's the end of the implementation station. I hope you learned something for today. Again, if you like this video, give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more OSCE videos, then hit the notification bell. If you want an in-depth answer, please click the join button and become a member. So your question will be pop up to the top and I'll be able to see it as soon as I can and reply as soon as I can. So thank you so much for today. This is nurseniezl. See you on the next one. Bye! Now we've come to the shout out of the day. So in today's video, I would like to congratulate at Chanili Deshika 4363. Congratulations for passing your OSCE exam. Also congratulations to at Haematoma 725. I'm glad that my videos help at Yemfat 6450. I'm really glad that my videos can help you at Sheila Caesar D7C.